Hi, and welcome to another Ask the Expert on with the ServiceNow community. Today, we're going to learn about artificial intelligence impacting legacy healthcare decisions, along with how to predict and prevent enterprise EHR disruption. Today's featured experts are Christopher Killian and Aaron Zuber, both of whom are legacy healthcare decisions, along with how to predict and prevent enterprise EHR disruption. Today's featured experts are Christopher Killian and Aaron Zuber, both of whom are legacy healthcare decisions. Sorry about that. And prevent enterprise EHR disruption. Today's featured experts are
Hello, Lisa, can you hear me?
Hi, yes, I can hear you. I apologize about that. I was getting some reverb on my computer systems.
No problem.
So please go ahead and start presenting. So thank you again for your time.
Great, thank you so much, Lisa. So welcome everybody. Aaron and I come to you from beautiful Dallas, Texas. So thanks for taking the time, and we hope this next hour will be informative, and hopefully you get a little bit of information to take back to your parts of business and obviously your efforts. So while we're getting the presentation pulled up, I just have a few short slides. I'll just reintroduce myself. My name is Christopher Killian. I'm based out of the Dallas office, and I've been with ServiceNow a little over 2 years, now with the MedSled vertical. And that vertical focuses specifically on healthcare solutions and state and local and education accounts as well. My background has been primarily all healthcare, so I'm going to be talking a little bit about machine learning in healthcare and where the industry is, how ServiceNow can help you really, I think, transform, in this case, any sort of inpatient, outpatient, and potentially ambulatory systems. So with that, we'll try to get the presentation pulled up so I can have a few talking slides.
Yeah, I'm trying to pull this up right here, and it's doesn't look like it wants to present.
Oh, no worries. So
why don't you go ahead and
sure, yeah. We were having just a couple of technical difficulties, but we won't let that stop us. We will move forward. So if you can, just for a moment, really think about sort of four kind of points when you think about machine learning and really automation. And the first point of that is really about doing more with less people, right? So there's a independent study that says by 2022 that there will be close to over $410 billion invested into healthcare. And when you think about that as we sit in 2017, just literally, you know, four and a half years away here, the reality is that's a lot of really new devices, a lot of processes, just really a lot of, I think, points that you've got to sort of connect the dots with when you really think about the number of devices that we're going to have to deal with. So it is IoT. It is about sort of streamlining and maintaining, if you will, really the technology aspect, right? So bear with me as I get the slide. I'm now seeing it here in front of me. So again, so the 4 points I really want to focus on as we kind of talk about that industry movement, right, is very much about how do you categorize work so that you can, again, address those issues. How are you benchmarking against your peers, right? How are you working to stay in stride? Maybe it's SLAs, maybe it's some sort of KPI that you've defined or that the industry has defined. It's a great way to say, how am I comparing to potentially the healthcare system that's across the street? And then probably, you know, most important point here is, you know, I want to be able to predict. I want to be able to literally kind of see in the future and understand how I'm scaling either up, down, left, or right. And ServiceNow provides you a creative way to get there through our performance analytics platform. So we're really giving you, again, ways to categorize work, ways to do more with less, see how you're performing with respect to your industry peers and competitors, and then ultimately, you know, provide you, that linear and even beyond perspective of measurement for performance analytics. So I want to focus in on a couple of key points. And in order to do so, I'm going to pull up just an internal document here. So again, you think about, oh, I'm sorry. No, we can go back to the slide. apologize. Yeah, so we'll still see on that first slide. It's a big slide, lots to talk through, right? So let's really focus on, specifically in healthcare, you want to treat the disease, not the symptoms, right? So what do I really mean by that? Well, in the case of healthcare, if I have a head cold or I have a cough, there's something underlying, right? There's a disease management process. You can really think about incident management, change management, and really the ITSM process very similar to that, in the sense of we want to create a prime category, a subcategory, and ultimately go through a triage process that today involves a lot of touch points, right? So there's kind of a negative force multiplier effect here. Think about the number of tickets, just plain old incidents today in your organization, and the number of human touches that are involved. That's so what we want to do with the platform specifically is help you categorize, help you prioritize, and then ultimately get to predictive assignment. So, we understand categories through business rules, prioritization potentially through other rules and or scripts can be done today. And you're right, it can. It's an effort with scripting, completely possible on our platform, and we have many successful customers that are doing that today. We want to take that a step further and truly drive innovation and transformation by saying, let's get into some kind of smart assignments. We know the groups that they should be going to. We've gone through an automatic triage process. And that's very much, when you think about this first point on the screen here, for categorization and routing work. Second point I want to make as we kind of take the circle here into benchmarks. So you're now assigning these tickets. You now have auto assignment, smart assignment, if you will. It's very important then to understand the anomalies, right? So we get into this sort of operational intelligence crosshair to say, well, what is an anomaly? Am I operating at the normal frequency, the normal threshold level, at a normal time? Maybe in your healthcare organizations, you have a change control process that has an EHR downtime every, Tuesday morning at 4 a.m. Maybe you have that set for a different time in your organization. The important takeaway from ServiceNow's perspective is to say we are intelligent aware when it comes to these anomalies. So that's really that sort of line in the sand you want to think about, to say, what? If I live at current time where I'm at today, I have a history of how we operate. I can then begin with the ServiceNow platform, specifically be able to look into the future and take those anomalies to see what the outcomes. You really get a chance to really model things, whether you're modeling to scale to take on an outage, or what I really want you to do is prevent that, right? We've been great about responding through our automation platform. What we want to do is say, let's just not automate to repair, let's automate to prevent. And that's a really big takeaway from well. So kind of moving again into that predictive point, it's a nice little segue there, right? We already talked about the markers of current time versus the history and what I want to predict on really kind of moving into the future. But it's important to say, how do we get there? Well, we would absolutely be extracting potentially data. And when I mean data, I really mean kind of behaviors of how you're using your ServiceNow platform and your ServiceNow instance. So it's not disruptive. This isn't something that is quote unquote impacting. It is very much about training. So we need to be able to train the data so that we can put it through revolutions really of intelligence to learn from itself, so that we can understand what's the application, what's the description, what's the severity, what is truly the assignment group. And I keep coming back to that because I don't want operational intelligence and AI to think of it's like something like HAL from the movie 2001, right? This is very applicable. This is something that can be used, and this is exactly how the healthcare industry is truly going to, in a lot of ways, move forward and transform healthcare. When you think about how do we make those investments by 2022, and more importantly, how do we deal with the onslaught of just Internet of Things devices that will be reporting to us? We have to have a mechanism, if you will, a hub, if you will, in order to drive this automation and collect it and make decisions for us and allowing us to help improve it. Again, kind of coming out of the prediction and really going into really the future, right? So how do I prevent? How do I model for the future? That's really for us a lot about our performance analytics portion of our platform. It's a way to set a benchmark, right? It's a way to let you take certain algorithms, and I won't get into the details of those algorithms, but it's truly a way for you to say, we are very much a peaks and valley organization today. And if I wanted to say what that looked like in 3 months, 9 months, 12 months, what is, from the platform's perspective, what is a way that we can get to some sort of either a bell curve that we can see the performance that we've up in the uptake, and then obviously follow that on the downtake. Where are we going, right? That's very much what performance analytics puts you in a position to help make those decisions and ultimately be more prescriptive in your behaviors so that you can drive ultimately the outcomes that you're looking for. So that's really this first slide in a nutshell. I'm going to go ahead and go to the next one. And you think about, what does that really mean in my healthcare system, right? So a lot of discussions, and not necessarily theory. What I talked about is very hands-on within the ServiceNow platform, something we're able to deliver. So you think about how do I do that? How do I digest this information? And it's very much to say, well, you have to set some stakes in the ground and say, in my organization, where am I? Am I modernizing? Am I transforming? Or am I truly a leader in my space, in my industry, and I'm innovating, right? I'm building purposeful applications on the ServiceNow platform, and I have the analytics, I have the measurements, and I have the industry sort of benchmark. I am the benchmark. And I think a lot of us, and I'll raise my hand coming from the healthcare space, I didn't always feel that I was in that last area of innovation, right? I very much felt like I was somewhere either pre-modernized or maybe a piece of modernized and a little bit of transform, right? Some of that's due to investments. Some of that's due to corporate culture and maturity, right? You have to really understand as an organization what you're trying to align with. At the end of the day, we all say patient care and better outcomes. And obviously ServiceNow is a platform from the MedSled vertical specifically that we want to help you take sort of journeys and let you mature your organization. So I'll just I don't want to read the slide to you, but in the sense of this format, I do want to kind of help you focus on the very bottom of the slide. So you see 32% modernize, 49% transform, and 19% innovate. This is a really great way fundamentally to compare and contrast organizations, healthcare organizations that are on this journey with ServiceNow, and really how they are comparing to one another from really their behaviors of using the ServiceNow platform and the ITSM process, or processes, I should say. So you can kind of see that a lot of our customers today are sitting in the transformation stage, and I don't think that's really shocking. I think that's very much where the industry says it is going, meaning we do need more self-service. We do need more automation, and more importantly, we want to measure it so that we can make those improvements and really move our business beyond where we've been and just buying new products, right? It's finally time with the ServiceNow platform not to have siloed ITSM. That's not the platform that we are. We are a system of engagement for visitors, for patients, and obviously for providers. And I think as you kind of work your way through this particular slide over to the right, you get to what we define as working at Lightspeed. It is kind of a key word there, is that predictive and self-healing component, right? And that's very much what my first slide discussed, which is really that machine learning process and predictive I think engagement that your organization potentially want to go through. Next slide. All right, so this is really a way to say, where does this live? Where does machine learning live on the ServiceNow platform? And it's very much the platform, right? So it's not something that you necessarily can say lives in any one of these particular layers, if you will. If anything, I think it's more, again, back on platform. It's really a construct benefiting from all the various offerings that ServiceNow has brought together on a single system of record. So it is self-service, it is performance analytics, and it ultimately is automation, all complementing one another and really providing you, a nice, in my opinion, a nice painting, right? It's not just one color, one corner of a canvas. You're very much putting together something that aligns to your healthcare company's goals, missions, and ultimately value statement. So with that kind of said, I'm going to turn over to Aaron and let him focus primarily on his presentation. So bear with us as I'm going to help present Aaron's information.
Okay, I'm going to go ahead and stop sharing. I'll introduce myself just real quick. So thanks everybody for joining. It's exciting to be here. I'm sharing the room with Mr. Killian. Like he had mentioned, I spent 14 years in healthcare IT. My background includes actually 2 customers from ServiceNow. So Back in 2006, we departed from our deployment at Ohio Health with Computer Associates, with CA, with a number of their different products, and we were able to meet some of the original members of the ServiceNow team. I remember Rob Bloody, who is actually our founder's brother, was my original sales account executive, and we got to know the team and the exciting things that they were doing with the platform, not only with the ITIL stack, which, you know, the traditional incident problem and change that really was changing the way service was delivered from an IT perspective, but also within the context of the hospital. So how are we really positioning ourselves to not only serve our IT counterparts, but also the physicians and clinicians that were making a difference in the lives of the patients that were visiting the hospital. So spent a number of years there, was able to help run their business continuity and disaster recovery program, which a number of applications were built within our ServiceNow platform in that instance to help run the business continuity program there, and then had the opportunity to go over and lead some pretty transformative deployments with ServiceNow over at Cardinal Health, which was in the Columbus, Ohio area, which is where I'm based out of. So really excited to be here and specifically just share some of my thoughts around cognitive and AI, and just what are the implications for this within the healthcare space. So I see, Chris, are you sharing your screen right now?
I should be. So if we're not able to see that, if Lisa, if you can let me know.
What we should be seeing is an AI screen with it's more like an infographic of some of the different artificial intelligence companies that are out there.
All right, so I'm going to try to present. I am presenting Christopher for everyone.
Yeah, this is Christopher. I should be presenting a cognitive computing slide right now.
Okay. Well, let's try to do screen share.
Okay, let me try. Let me stop this.
It looks like the Google gods haven't been so kind to us today.
Is that any better?
We still see you. We're not seeing your screen share.
Okay. Oh, that's not what I wanted, sorry. Stop presenting. Application, yeah. Is that any better?
Yep. Oh, there we go. Cognitive computing.
Cool. Let's go ahead and go to that second slide real quick.
Okay.
And the reason I like to start off with this slide when we're having the conversation around what is artificial intelligence, just to give everybody an idea of the depth and breadth of this concept, that the interest when you say artificial intelligence, what does that really mean? So there are a number of different companies out there. If you go to info@venturescanner.com, and there's a bunch of these different companies out there that have their own opinions and information about these different companies, but this one has counted 957 companies. And if you scan through these different categories, the chances of you actually recognizing a good number of logos is probably pretty small. There's a lot of different companies out there in very niche markets specific to artificial intelligence. That could include anything from context-aware computing to maybe speech-to-text, which we're probably all pretty familiar with, or maybe natural language processing, or a number of different applications within this AI category. So I just wanted to start off with that, just to give everybody an idea of what we're kind of talking about when somebody says AI or artificial intelligence. And we can go ahead and move to the next slide. And this is another one that just basically shows when you take a look at these companies, how are they actually categorized? So which ones are focused on which? Not to say that not a particular company can't do more than one thing, but machine learning by far is the leader, followed by NLP or natural language processing, and then on down the stack with smart robots, which you might be familiar with, video content recognition, all sorts of stuff like that. So when we talk about artificial intelligence, cognitive computing, machine learning, what really comes to mind? And you might have a lot of different things that are going through your head. No, you can go ahead and go to the next slide, because we have the the machines are going to take over the world, and it's not going to be a good thing. Or maybe you can go to the next one. Maybe this is your mental picture when you think of what machine learning, AI, cognitive means. Or maybe it's a couple years back when you saw the Jeopardy series with IBM's Watson. So maybe this was something that when you think of cognitive computing, the capabilities, maybe this is what comes to your mind. If we go to the next slide, these are just some of the different displays that were at the World of Watson in October of 2016, which was last year. Some of the problems, and this has changed even a lot over the last several months as we get into more direct application within the healthcare space, but a majority of the ones that we saw, it was very evident that they were just conceptual. So they really did a good job harnessing the power of imagination and creativity, but struggled to find their way on a wide scale to the marketplace. So we're making enormous strides with that, but there's a lot of conceptual ideas and, what does this really mean for us? And if we think of it in the context of healthcare, I saw more applications that made a whole lot of sense of this wash of data that healthcare is in right now. Mm-hmm. So, when I get back to like a customer example, one of the companies that I actually worked for, Ohio Health, it's, how could we successfully, engage these types of capabilities within the context of healthcare that Ohio Health struggled with? So if we go to the next slide, what really to take a step back and say, okay, well, what is machine learning? What really does that mean? So this is a portion of what we consider cognitive computing, an application of artificial intelligence. It's leveraging supervised algorithms. You're basically taking an enormous amount of data, and you're taking that and you're trying to make sense of this enormous amount of data. So what we've done with Ohio Health is take a look, and like Christopher, you mentioned with ServiceNow, we have access to all of this data because it's all shared in one spot.
Correct.
So we're able to make sense of things. If I'd say Ohio Health, for example, back in 2007 when we actually deployed, I have access to all of those records as an Ohio Health system administrator or leader. Now that I'm a ServiceNow customer and have been for the last 10 years, I can take machine learning capabilities and I can apply it to all of the different things that I've been using ServiceNow for over that past 10 years and actually start to make heads and tails of it. Am I approaching our service management practices the right way? What are really the things, not the things that I feel are our biggest issues, but what really are our biggest issues? How am I transferring these different issues to the proper teams? How am I making heads and tails of the outages that we're having? How am I doing on the time, and in terms of my predictive capabilities? So am I seeing these patterns? Am I recognizing these patterns in a way that enables me to get in front of a particular outage? And then how are we communicating that internally? So when I think of machine learning, these are some of the things that come to mind. And then if we go to the next one, when we think of like cognitive intelligence, so obviously another application in AI, systems that can make, take a computable and act virtually, and I say virtually with air quotes here, autonomously in many problem-solving situations. So this is probably more along the lines of when folks think of AI or cognitive intelligence, this is probably more in the lines contextually of what they're thinking of. So easily interacting with other folks, whether it's natural language processing or a virtual agent, those different types of things. And then if you go on to the next one, just robot process automation or RPA. So how are we doing this? How are we scaling the capabilities that we've deployed internally? So I wanted to make sure that at least when we're having a conversation of cognitive capabilities, artificial intelligence, machine learning within the healthcare space, some of the things that we can, at least from a vernacular perspective, have a common core understanding of what we're talking about when we say these things. And if I go to the next slide, when you're looking at what does it really look like from Ohio Health's perspective, that they were really struggling with. So, status updates, password resets, a lot of access issues. So how can I take this? And these, by the way, aren't just, a finger in the air type of, Kentucky windage. These are actually machine learning, that we had turned loose on their data and said, look, we really want the numbers behind these over time, trending over time. What are we really looking at? And then we're going to use the capabilities of cognitive and AI and robotics to actually start to address these. So this is machine learning, bringing these numbers out, showing what the different trends are, showing what we're struggling with, and then being able to take some of those capabilities and address those in a way that's automated, it's quick, and we're able to actually, give folks their status updates, their password resets, all of the things that make it necessary from a foundational perspective to take it to the next level. So we probably don't need to go into the next slides here because that gets more into the reference architecture and all of the different things that actually made that use case successful. But I wanted to just kind of kick it around with you a little bit, and I know you have a lot of experience, from a healthcare perspective as well. And I know you have some thoughts about, how that would have been, helpful for you, or maybe how you're seeing it now in some of your customers to use capabilities like this, and maybe what we could see coming down the pike, not only with ServiceNow, but just from an industry perspective.
Yeah, I think that the natural language, you talked about NLP, right? So natural language programming. I think that's going to be a really staple or big staple in the healthcare industry, specifically around, we've already had dictation, for many years. We've somewhat tried to progress that as both a self-service software. Maybe we've also got into the an actual kind of a dictaphone service. But I really think that NLP is going to be kind of that, not necessarily pie in the sky, but I think it's definitely coming, right? It's that next 5 years. It's that maybe hopefully sooner. I'd like to see it sooner, but I think that's going to be one of the areas that ServiceNow specifically could definitely see a play regarding what are we going to be able to do with NLP? How do we get past brute force learning and actually getting into sentence structure and extraction? That doesn't exist today. But I can definitely tell for this industry, it's going to be impactful, and for ServiceNow specifically, I think it's going to be one of our hopefully key focuses.
Well, yeah, and I think, and probably some folks that are on the line here too have some very specific thoughts around that. But when I think of the healthcare system and the environment with the ability to take NLP or natural language processing and really help to cut through some of the clutter. So when I say something to you in a clinical environment, that might mean something to me, but something completely different to you, or especially when we're talking about patient care, when there's language barriers. So how do we take the capabilities of artificial intelligence and enable us to be better clinical providers in that space, and to really break down those language barriers so we can get right to the care that they need? Because we're moving, especially stateside, that's a lot of the things that are changing, is that we're going from a historically volume-based, to an outcome-based. So are they coming in? Are they getting the type of care that they really need? Are they getting it when they come in? How many times does it take somebody a visit to a hospital or healthcare system before they actually start to see the benefits of those visits? Do we really address their needs and give them the outcomes that they need initially, or is it something where they have to keep coming back time after time after time? So as a provider, how are we using technology to improve our efficiency and our efficacy in that space? And I think, like you hit on, with NLP, that has some very unique, and it's very interesting to think about, how can we use that to kind of break down the language barrier and get everybody on the same level, at least, so we can start having those critical conversations and a common understanding of why they're actually, visiting our facilities and what do they actually need.
Yeah, you made a great point about kind of the touch points with the providers and obviously the cycle of health management, right? So one thing that stands out to me is, with the ACAs in 2012, one of the key measurements that we're penalized against, right, in healthcare is readmission rates. And you think about, people, we can't, as an industry, technology and healthcare industry, say, well, we're as healthcare professionals and as hospital systems, we're scared of adoption. You can't take that approach, because you cannot deal with the number of touch points that are coming in order for this increased measurement. You're going to have an engine of sorts, some sort of automation engine. We talked about BCP for years, right? BPC, business process engines, for a long time. The reality is, this is an automation engine. ServiceNow is very much a white space filler, right? To take some words out of our own CEO's mouth, that's very much what we are. And I think that's a great approach. There are a lot of fantastic siloed solutions, we are a fantastic bridge or a conduit in order to make these solutions work together. So readmissions rates and reducing those is direct. It could be a direct benefit of something of where really AI, ML, machine learning is really going. And I'm with you. I think AI. I think of robots. I prefer ML because to me that's logical. I can teach through supervised data sets.
Machine learning.
Right. I can absolutely teach a system of record to learn from that.
Well, let's go into that real quick, because I think one of the most significant things, and I want to make sure that we keep the focus on the clinical space, but also and to kind of piggyback on a message that the CIO of ServiceNow, Chris Beatty, when he talks about ServiceNow, leveraging ServiceNow effectively internally.
Yep.
IT strategy is business strategy.
Yes.
So we've seen huge investments in the clinical space around EHRs, interoperability. How can I take, whether it's, product A or product B, implement that effectively. And what we've seen is not only do healthcare systems adopt EHRs at great cost, both financially and then from a human capital perspective, but they're doing it in a way that enables them to grow by acquisition as they reach out to rural communities, physicians' practices, and stuff like that. So when I think of machine learning capabilities specifically within a ServiceNow context, I also think of our ability to make heads and tails of what's going on in the environment. And I know you came from the IT operations management space, which is dealing with events, outages, the prevention of that. So, what are your thoughts on, machine learning's ability to address, patterns within, an infrastructure space that eventually would lead us to reduced outages, more uptime for, our charting capabilities, our med-admin capabilities? What are some things that you've seen IT kind of transcend from the back office into the clinical space?
Yeah, that's a great question, and kind of a nice segue. So for me, it's been really about anomalies are one of the, I think the kind of the key focus, right? The state of the anomaly. And that's because we have supersets of data in operations management and big data centers, right? And healthcare is not void of supersets of data. There are behaviors, both good and bad, but I think in a lot of cases, what an organization will find is that they think that every sort of event, every sort of occurrence is unique. And a lot of times it's not that unique. The reality is there is a behavior of independent applications who either produce a negative sort of lineage of events or negative outcomes. So it's a way to try to group those. Our operational intelligence engine built on the platform for ServiceNow specifically, it does a fantastic job relating the events, right? So saying if I'm seeing 2 on the left and it's this time of day, the sort of prediction for the next minute, next 5 minutes, next day, if you will, this is what we're trying to really curve, right? So that's been one of the big focuses I know for our operations management group that I did come from, and now impacting our healthcare accounts. I think that directly leads to more uptime for EHR systems. It directly leads to more uptime for all the ancillary systems that support the EHR. So it's just a matter of bringing those applications into the ServiceNow platform. Again, ServiceNow is not trying to be a replacement for these applications by any means. Simply trying to be that conduit to help you be more effective in the way that you're managing and ultimately, in this case, using analytics, machine learning analytics to be more effective and efficient.
One other the question that I actually was curious to get your thoughts on was more along the lines of when we have, if you think of all of the things that physicians and clinicians are trying to address as they try to provide for the patients. Not every case, one case is completely different than another case, even though there might be a similar diagnosis. So really bridging the gap between somebody that's practiced for a long time and somebody that might be new to that space. How do you see, and I'm thinking of in the context of knowledge-based training, enablement, certifications, all that type of space, all that type of things. How do you see artificial intelligence and cognitive being the bridge between and maybe condensing those learning cycle times and giving physicians the data that they need to make better decisions?
Yeah.
Based on something that might be other than experience. I don't have 20 years of experience, but I'm expected to do, the same type of high quality work. How can that? I
think a simple, I can't say simple, but one that's real in healthcare is really the progress note, right? So I think that the onboarding process, kind of putting that aside for new physician and maybe existing physician or provider, I think it's really more important, something like a progress note, to be able to sit back and say, here historically for this type of diagnosis, right? Almost like a miniature library of medicine, right? So it's definitely not, it's not a position to say that the computer is now instructing how to provide care. That's not it at all. It is based on this community, these diagnoses in this healthcare system, the system that you work in, right? It really is a matter of what are the services that we provide, both ambulatory services, inpatient, outpatient, and who are our specialists. And I think that's really what you're going to see, is how to say, what does the industry say about machine learning? It's going to be very much specifically about, in this organization, for the services that we provide, here are the types of trends, if you will, for the outcomes that we want to have, not the negative outcomes. And here's that roster of really treatment plans. Here's that roster of notes that, it's not, this isn't canned notes by any means. This is very much a prescription in behaviors in order to really drive, if you will, this particular outcome, clinical outcome. And I think AI will, machine learning specifically, will help be a real distinction there. I think that's going to be very real. That's one of the more common areas for providers today, and always has been.
And I think too, along those lines, and kind of taking it back to the IT side of things, that is, in a lot of cases with these large EHRs that customers have decided to invest in, they also come with their own support staff to make sure that the clinicians, as these things become more and more complicated, are getting the support that they need. They know exactly what they're going to do, where to click, what to do when they're dealing with patients, whether it's medical administration, whether it's different charting activities, any of those types of things, even to the idea of, hey, we're using these systems within our operating room context as well. I see one of the use cases, and to kind of jump back to the Ohio Health example, because there was a ServiceNow integration built with IBM's Watson, and one of the big use cases with them was to take all of this knowledge that was in their environment, not just knowledge within ServiceNow, but knowledge where are these, and I'll use a AI term, corpus. Where are these corpuses? Where are they located at? Is it SharePoint? Is it somebody's OneNote? Is it not in knowledge base within ServiceNow? How can we tap into that, and then through an agent assist or eventually a completely automated fashion, get the right people, the right data at the right time? So if it's an agent assist and I'm sitting behind a desk and I'm answering calls and I'm looking at screens, how do I get exposed to the right type of data that's relevant to that conversation I'm having with a clinician that needs my help immediately so they can better take care of it?
Almost like a triage process.
Almost like, yeah. But instead of me turning to you, who's been here for 10 years longer than I have, I'm using a virtual agent that's giving me the right information that's pertinent based on the conversation that I'm having. So maybe there's natural language processing going by, and they're saying, hey, when somebody says this, it means this. Therefore, you need to look at this type of knowledge or this type of corpus versus something else that maybe I go down a rabbit hole. But do you find that, and I don't know where the different systems that you came from, what their deployment strategy looked like, but did you find that there was a big investment in those types of specialized, service centers where they would focus specifically on clinical needs and expectations right out of the gate? I
think the answer is, were there investments being made? Yes, for agents and what I would almost call bots, robots. And I don't mean that so much in the sense of something mechanical. I mean something about software assistance. I think that at the time, that was probably a little premature in both the dollars being spent and also the technologies that were available. And from ServiceNow, I think where we're going in that direction is, we are very much focused around, what is that agent technology going to be? I can't say I sit here today and know exactly what that's going to be. I think that in our future releases, it's definitely going to be something that we want to incorporate and obviously grow and harvest. So I think that the opportunity within healthcare is agents, bots are going to be needed. They're going to have to be connected amongst many or disseminated amongst many other platforms, right? We want ServiceNow to be that hub for the processing. And ultimately, we are reaching the EHR systems, but I think we're going to be reaching out to a lot of IoT devices as well. Maybe that is, we went back to the dictaphone example. Maybe it's as simple as the microphone itself, and seeing what, would there be, an agent relationship there? I don't have that answer, but I think that it's definitely on our track for roadmap and what we want to be a part of regarding, the impact of the healthcare industry. So awesome. I guess, Aaron, I've got one for you because I know you've spent a lot of time with Watson.
I know, I've peppered you with questions.
No, that's okay. That's okay. That's what this was for. So Aaron has spent a ton of time for our web fans out there with a lot of our IBM Watson partners and obviously growing that side of the ServiceNow business integration. So just tell us kind of the fun stuff. I mean, I know we've talked a little bit about here's how to apply in healthcare, but when you first got introduced to it, and by the way, I've been playing catch up on Watson versus how in relationship to how ServiceNow is using it. But what's been some of the great stuff? Like you just like, wow, I didn't realize that we have progressed this much in technology, and now we're having applications. We know some of the applications, but just keep it lighthearted. What was some of the fun stuff you kind of came across?
You mean
other than Jeopardy?
At the World of Watson?
Yeah. Oh, yeah. Other than Jeopardy, I mean, what was kind of fun?
Okay. Well, I mean, again, just like I mentioned at the beginning of the presentation, the first thing that struck me was just the magnitude of creativity that was there, from the Ollie self-driving car to I played paper rock scissors with a robot that basically took the data from it played paper rock scissors with 10,000, 20,000 people, and was got to the point where it was learning about if a person that comes in at this time of day and does this particular thing is more likely to I'm more likely to play paper after doing rock twice than I am, and just just very just data points that you wouldn't really think as a person would make sense, but you take all of that data and you put it together, and it really starts to make your predictive capabilities very, very effective.
Did it change the way you were trying to outsmart?
Yeah, probably pretty much did. What do I want to do? And then I did the opposite of it. I actually won.
All right.
And then I stopped playing because I knew that would only last for so long.
Got it.
But no, it was the interesting thing was the ability to take enormous amounts of data that would just crush any analytical team, and be able to, based on the context, to take that data and make it meaningful, so that I could, based on that, do a particular action or look for a particular outcome, an actionable outcome that would make sense within that business context.
That's cool.
So whether it would be weather predictive analytics, tons of data, and I think within back to the clinical space, when you have physicians and clinicians that are reviewing just massive amounts of data.
Correct.
And we're talking about everything from preventative types of things to you're talking about genetics to very, very specific types of cancer, and what have the outcomes been, has the efficacy been in these outcomes prior, and how can I tap into all that data so that when I'm trying to make a decision in the best interest of a patient, I have all the data that I need, and the machine, the AI is not making the decision for me, but it's giving me relevant information quickly, so that I can triage the different treatment plans and tailor the different treatment plans based on genetics, based on outcomes, based on a whole bunch of other environmental factors. And I thought that was very, very compelling. I'm not no stranger to the clinical space from an IT perspective, but also had a chance to be from a patient perspective. My son has, and I think you and I had talked about this, has undergone 3 open heart surgeries, hypoplastic left heart, and just the amount of data that the physician teams had to go through in order to, make sure that he got the care that was critical to his survival. And a lot of other families going through the same thing. I think my wife going through, breast cancer, and all of the things that the physicians had to take into account in order to make sure that her care was
multi-specialties,
and it was, when we talk about options, there's a ton of options from a layman's perspective, me being a layman, versus what are they, how are they counseling me, and what are they counseling me based on? Do they have all of the data? Do they have the right studies? Do they have everything within a certain space where they can actually make those decisions and share with me and enable me to help them with a course of correction? So very, very complicated, but I thought it was the thing that I noticed most about the Watson, and it wasn't just, it's not just IBM's Watson. There's a lot of other, like we looked at, there's tons of companies, close to 1,000 companies that are doing very, very exciting things. And I think the one thing that kind of opened my eyes was that there's, just the creativity that's out there to help kind of harness this processing power and really bring it into a space that can make a meaningful difference for you and I. And that was one of the things that I think, kind of reaching back to an earlier conversation, what really drew me to come to the ServiceNow family was, I'd been a customer at Ohio Health. I had helped, select ServiceNow and implement ServiceNow. Did the same thing when I went over to Cardinal Health, implemented ServiceNow, managed that entire team, and was able to see the difference that it made within the lives of the folks that were in our immediate circles. But then to say, look, I really want to do this on a bigger scale, come to the ServiceNow team and help other, companies and other people actually translate all of the things that they're doing within the IT space specific to clinical and have that make a meaningful difference and a material difference in the lives of the folks that they're really there to serve to begin with. Because as you know, with IT, traditionally been more of a back office process place than a, in the front of the business. So was I really affecting patient care in a positive way, 10, 15 years ago at Ohio Health? I like to think so, but it was definitely much more of a dotted line. Today, I think we're seeing the decisions that we make in the infrastructure space and the information technology space affecting our ability to deliver high quality patient care almost immediately.
Consistent.
So I think that was probably, knowing that, coming from that background, that was probably the most exciting thing. And I also think back to the language barrier thing. I think, if we have a way to kind of unbabble ourselves, so to speak, and make sure that we're using the common language, and that would just help with the conversations that we're having with not only with the clinicians, family members, all that other type of stuff that's critical with the continuum of care, would make it really critical for us. So I thought seeing all of that in action was very, very exciting. I think for the folks on the call that maybe are ServiceNow customers currently, the things, and I'm thinking, and I want to give you my opinion and maybe toss it back over to you to see, what is this? This sounds good. What does this mean for me as a customer today? What is ServiceNow doing in order to help, bring where I'm at into, to the next level? We hear a lot of good things. But what does it actually mean for me? Without any, forward, thinking statements, or it's going to be available in this release, or whatever the case may be. But today, just seeing the things that we're doing in benchmarking, being able to take all of that data for the customers that are participating with it, and being able to see, how am I doing in relation to these processes that I said are important enough for me to invest in? How do I stack up against my peers? How do I take those and then enable, our teams to set targets and then really reach higher goals? How do we continue that incremental progress that is, important to raise the bar, in that space? So I think the benchmarks, and I don't know if there's anything that comes to your mind for customers or prospects, with ServiceNow.
No, I think the benchmarks are a real distinction point. When you think about what we're doing in the healthcare industries, but more importantly, think about how healthcare is managing their sort of patient perspective. I mean, that is with surveys, right? And those surveys impact, how do I get paid? And I think it's a real testament of the ServiceNow platform to say, healthcare industry, we understand that first and foremost. And second, we want to show you internally so you can sort of get a chance to course correct before you're delivering the care. And I think that's the biggest point of all this. That's
pretty cool. Well, it's interesting that you say that, because when somebody thinks of surveys, they think, oh my gosh, this is, I don't want to do this. But when you think of the data that survey can bring, and a lot of times, especially with the response rates, you have to survey thousands and thousands and thousands of folks to get meaningful data back. And then when you're trying to crunch that data, so you're talking about the application of whether it's machine learning or cognitive or whatever the specific application would be, to make heads and tails of that with a very, very large population.
Absolutely.
And then turn that into actionable items for the folks to work on.
Absolutely. I mean, I know in certain systems I've worked in, just talking about ER, patient, consumer, consumption of health in the ER. All kinds of products are on the market today to sort of interact and make course corrections before that patient is discharged. And I think that the service, specifically with ServiceNow, this platform from a benchmarking perspective, as well as that sort of prediction perspective, it's all about course correction. And I think we'd all like in golf. I'm not a big golfer, but in golf, I know you get mulligans. And I'd love to take a mulligan and say, in my career, for certain things in healthcare, say, if I could just redone that, if I could just had an opportunity to just polish something, we could have provided an even better outcome. We could have gotten a better survey. We could have increased our reimbursement. That's exactly what we're trying to do. I know that you and I, representing MedSlip, it's exactly what we want to help our customers, prospects achieve. And I mean, I'm passionate about it. I didn't get a chance to go into my healthcare background. Aaron's got a fantastic one. I have a long tenured one as well. And you made a point earlier about, just kind of had a note here. You talked about in your own personal life some of the the health challenges your family's had. And thank you for sharing, and obviously thoughts and prayers. But more importantly for this conversation is really about, it's not just about having, we as consumers of healthcare, we say, I want to find the best doctor. Today, it's I need to find the best doctor and also who has the best data. And I know that's not something we think about, but it's going to be a combination, right? We absolutely want the best providers. We're not eliminating doctors from this. What we want to do, and I think is in the ServiceNow brand, is help the healthcare systems get to the most meaningful data that can help them make the best decision. It's not to replace. If anything, it's to help remove some of the noise and reduce the error risks there.
So. Absolutely. Well, I think it's been an amazing conversation.
It's been cool.
We have, I don't know if we're coming to the top of our time. I don't know if we want to kind of shift gears here and maybe go to some Q&A or what is next on the agenda. So.
Yeah, I feel great. Appreciate the back and forth. It was really good. It's really good dialogue. I don't see any questions inside of chat, so I'm going to.
And I've been checking on the community, and we certainly haven't gotten any questions yet, but I think our audience might have so much to absorb. Perhaps they'll post their questions on the community, and you all will be attentive to answer them.
Absolutely. Be happy to.
Well, great, gentlemen. Thank you so much. Well, I have learned so much today, so appreciate it. And we'll hopefully, if you'd like to do another session soon, we'll catch you on the community.
It was great. Thanks for having us out.
Thank you. Bye-bye.
Thank you. Bye.